Hello, everyone. The previous session and also some technical difficulties we're experiencing in this session will underline again the importance of traditional methods that is being tested over and over again millennia and not fail much. But still, we're moving ahead. I think if our first presenter from Ukraine is ready, we can start. Mr. Andrei, are you ready?
Yes, I am.
In that case, we'll leave the word to Mr. Andrei. Thank you. We're listening to you now. Thank you.
Okay. So I can start.
Yes, please.
Okay. Good afternoon. I am Dr. Andrei Zbuchea. I am a plastic surgeon from Romania. I work in plastic surgery department, District Emergency Hospital of Ploiești. And I have the pleasure to present you my work entitled The Importance of Apitherapy in the Surgical Approach of Open Arthritis, Case Report, Implications, and Perspectives. As introduction, honey is a traditional remedy which has been used for wounds since ancient times. It has been the subject of extensive studies that have revealed its multiple actions which are favorable for wound healing, such as antibacterial, anti-inflammatory, anti-edematous, and anti-exudative, antioxidant, providing moist local environment, debridement of the wound, increasing the rate of healing, and also nourishing action in the wound. I have also used the volatile or essential oils, which exhibit multiple actions which are favorable for wound healing, such as antibacterial, anti-inflammatory, analgesic, local anesthetic, antioxidant, and wound healing stimulations. They highlight a broad spectrum of anti-infectious activity, antibacterial against gram-positive and gram-negative, including methicillin-resistant Staphylococcus aureus, antiviral, antifungal, and antiparasitic. The apiphyto combinations, which I have successfully used, include honey and volatile oils, which have shown multiple properties and favorable effects for wound healing. The antiseptic actions of volatile oils increases the intrinsic anti-infectious effect of honey. These actions can be extremely useful, especially in problematic cases of wounds with joint or bone exposure, especially when they are infected with multi-resistant germs with difficult healing, poor local defense, and limited local regional resources. My case report, which I am going to present you, is a male patient, 42 years old, which was admitted to the plastic surgery department, District Emergency Hospital of Ploiești, Romania, for the treatment of a severe burn by electrocution at the level of the right hand and forearm, and of the left thigh and leg. The lesions were very deep, with necrosis of tough tissues and the opening infection of the right wrist. The bacteriological analysis from infected wounds revealed multi-drug-resistant germs such as Acinetobacter and methicillin-resistant Staphylococcus aureus. There is a preliminary photo with burn wound through electrocution after surgical debridement and initial skin grafting. With partial failure of the skin graft and opening of the wrist. The treatment was prolonged, combined medical surgical, and comprised multiple debridements, skin grafts, and regional flap harvested from the dorsal face of the right forearm. The flap was posterior interosseous flap to cover the open joint of the right wrist with bone exposure. This is a photo with bar wound after partial integration of the regional flap, which is that, and skin grafts. But it remains a skin defect right here. I decided to use the combination of polyflora honey and 1% high volatile oil topically, pre and especially post-operatively at the right wrist. Concerning the results, the evolution was progressively favorable with the remission of wound infection, integration of skin grafts, and gradual closure of the open and infected wrist joint. But due to flexor tendon and median nerve necrosis, due to electrocution, the patient remained with complex sequelae in the right hand, which required further reconstructive surgery. This is the final aspect with progressive wound closure after serial debridement and application of honey with thyme volatile oil. As discussions, this case report is a difficult case of deep burns to electrocution with severe and disabling injuries. It highlights the efficacy of the combination between surgical treatment and topical applications of honey with thyme volatile oil. This mixture is especially indicated in such cases with deficient local defense and infection with multi-resistant germs. Applying medical grade honey can provide a definite favorable action on healing of burns and other wounds, especially when they are infected, sometimes in combination with surgical treatment being applied in these cases before or after surgery. The anti-infectious activity of honey without the development of microbial resistance is particularly useful in the present times of bacterial multi-resistance to antibiotics and of increasingly limited access to antibiotics of last generation. But in order to be considered in the treatment of wounds and to excel without risk the whole range of favorable effects, honey must be organic, harvested and processed properly, and sufficiently free of microorganisms. Regarding these terms, sufficiently free of microorganisms, strict microbiological criteria have been proposed for bacteria at a maximal limit of 10 colony-forming units per gram of honey, and for fungi at a maximal limit of 10 colony-forming units per gram of honey. According to article published by Hermans et al. In 2019. Honey suitable for medical application has to satisfy certain requirements being characterized as medical grade honey, which is necessary to fulfill the following criteria, according to the same article, published 2 years ago. Is organic and free of different contaminants and toxin substances, is sterilized, especially through gamma irradiation under standardized conditions and free of harmful microorganisms, can be safely used in medical therapies, follow strict production, storage standards, and legal and safety regulations, and comply to the physical-chemical criteria that are important for the use of honey as a wound care product. In conclusions, the combination of honey and thyme volatile oil represents a potent compound with wound healing and anti-infectious effects and can be applied especially in these difficult cases with the exposure of osteoarticular structure, poor local defense, infection with multi-resistant germs, and limited surgical possibilities. This case report highlights the effectiveness of the combination of surgical treatment and topical applications of honey with volatile oils, natural potent agents with wound healing and anti-infectious effects. But further clinical studies are needed to establish the best indications, methods, and form of administration of medicinal honey, sometimes in combination with other natural products, such as propolis, beeswax, and volatile oils. Thank you very much for your attention.
Thank you, Dr. Andre, for this very nice presentation. I think your presentation underlined another important issue that we need evidence-based medicine, and for that we need many studies, especially designed for randomized controlled studies. And the case studies actually in this sense very valuable, but don't carry much weight in the issue of apitherapy or the traditional medicines. And also one of the biggest things you underlined from your presentation is we need guides, internationally accepted guides for the use of these kind of methods. This is actually still in the people's best abilities, which is not very false according to the what we see throughout history. If you let me, I'm going to tell you a few more things after Mr. Timuçin Atayoğlu's nice presentation. And I'd like you to join me with a little mind-boggling discussion, please. Thank you. Are you ready, Mr. Ali Timuçin Atayoğlu?
Thank you.
Yes, Ali, you can start. You can start if you are ready. And we'll have the discussions at the end also with Dr. Zbuka and Professor Mustafa.
Okay. Can you see the slides?
Yes.
Yes.
Okay. Well, thank you very much, dear Chief of the Chair of the session. I wish a nice session. And I appreciate and thank to Dr. Andrea for his nice presentation. We have heard about him previously, and we are happy to have him here. We are in the sessions now today, apitherapy in clinical practice. So we are discussing different issues from the clinical perspective. And I would like to share with you a very short message of the potential of apitherapy in preventive medicine. In complementary and traditional medicine, we emphasize holistic approach, integrative approach, and we also emphasize preventive healthcare approach, as you know. So I wanted to make it as easy as possible why we have to use apitherapy in preventive healthcare. Let me first remind what we mean by preventive medicine. Yes, preventive medicine is, shortly, we can describe it as the maintenance and promotion of health and the reduction of risk factors that result in injury and disease. Well, the definition is easy and it is quite logical and understandable. But when it comes to healthcare, most people act, we see, reactively instead of proactively. Many won't go to doctor until they are sick, and they won't take care of their body until problems start to arise. However, impressive evidence supports the value of clinical preventive medicine. Much of medical practice is based on a disease treatment model rather than a prevention model, in that the predominant focus is on treating existing symptoms and conditions, while we would argue this approach is necessary for acute conditions, of course. There is some question whether this is the most efficient and effective way of delivering healthcare. I am sure most of us here will agree with me in this point. The leading causes of death, especially in the developed countries, have changed markedly since the beginning of this century. There has been a shift from acute infectious diseases to chronic diseases. Therefore, clearly, we can say many of these chronic diseases could potentially be prevented or delayed through primary prevention activities. Which chronic diseases are we talking here? Chronic diseases, including heart disease, cancer, chronic lung disease, stroke, Alzheimer's disease, diabetes, osteoarthritis, chronic kidney disease, are all the leading causes of poor health and long-term disability. The clinical preventive strategies are available for many chronic diseases. These strategies include intervening before disease occurs. We can call this primary prevention. And detecting and treating disease at an early stage, that we can say secondary prevention. And as third, managing disease to slow or stop its progression, which is, we can say, tertiary prevention. These interventions, combined with lifestyle changes, can substantially reduce the incidence of chronic disease and the disability associated with chronic disease. You see here, the World Health Organization is emphasizing this point, changing lifestyle, having healthy diet, exercising, and all the activities that we can have to prevent chronic diseases. Well, when we are talking about chronic diseases, we have to remember the role of free radicals. Oxygen is, as you know, is a highly reactive atom that is capable of becoming part of potentially damaging molecules, commonly called free radicals. Overall, these radicals have been implicated in the pathogenesis of at least 50 diseases, we can say. In plants and animals, these free radicals are deactivated by antioxidants. Well, antioxidants are defined as the substance that delays, prevents, or removes oxidative damage to a target molecule, or substance that directly scavenges reactive oxygen species or indirectly acts as inhibitor or reactive oxygen species production. Antioxidants play important role in the prevention of free radical formation and helps in reducing various disorders such as cancer, aging, cardiovascular disease, cataracts, immune system decline, and brain dysfunction. These antioxidants plays diverse physiological role in body by inhibiting the process of oxidation, even at relatively small concentration. And as we know, cardiovascular diseases are today seen as the principal cause of death in both developing and developed countries. Cardiovascular diseases include atherosclerosis, coronary heart disease, arterial hypertension, and heart failure. And the major reason behind these cardiovascular system diseases is what? It is oxidative stress. It is generally accepted that most of, if not all, the beneficial health effects of dietary polyphenols are attributed to their antioxidant and chelating capacities. So now we are approaching to apitherapy. You can feel that. Well, World Health Organization established a strategy on traditional medicine. The WHO traditional medicine strategy for 2014 to 2023 was developed and launched in response to the World Health Assembly resolution on traditional medicine. Accordingly, one of the main objectives of the WHO, World Health Organization, traditional medicine activities is to facilitate integration of traditional medicine into the national healthcare system by assisting member states to develop their own national policies on traditional medicine. So World Health Organization is encouraging us, who are we, the members, the member countries, to facilitate integration of traditional medicine to conventional medicine on an evidence-based strategy. Well, as you know, Turkish Republic had a regulation on practices of traditional and complementary medicine, which entered into force in 2014. And now it is evident that Turkey now has well-coordinated, comprehensive regulations in traditional and complementary medicine that are the first of their kind in the world. Under this new regime, 15 distinct types of traditional and complementary medicine are addressed under one overarching regulation. The regulation states 15 separate methods of practice for traditional and complementary medicine. These include acupuncture, apitherapy, chiropractic, cupping, iridotherapy, homeopathy, hypnotherapy, magotherapy, mesotherapy, music therapy, osteopathy, ozone therapy, phytotherapy, prolotherapy, and reflexology. And it is going to be updated very soon with new therapies. So apitherapy is one of these 15 therapies, and it is using honeybee products. We can, in short, define it. And it is used to prevent or heal a number of different conditions as wounds, rheumatic diseases, immune or neurologic conditions, and alimentary tract disorders, among others. Honeybee products as honey, propolis, pollen, royal jelly, beeswax, and bee venom have been among the most commonly used natural products in folk medicine by virtue of their powerful healing properties and high bioactive molecule content. And if we remember what we were talking a minute ago, chronic diseases and how antioxidants are important for prevention of chronic diseases, we can see that honey is very nutritional product, and propolis as well, with many kinds of vitamins, flavonoids, trace elements, trace organic acids, minerals, amino acids, a variety of terpenoids, and also bee pollen, royal jelly as well, which is very rich in nutrients. Royal jelly contains a special nutrient called desanoic acid. We can remember that point, which cannot be found anywhere else in nature. So these products are really unique. And we have many literature, many publications, studies on the issue showing that honey is very rich antioxidant product the antioxidant activity as a biomarker of honey varieties, you see. Similarly, bee pollen is an antioxidant superstar, we can say. Propolis as well, one of the most powerful antioxidants. You see, there are some publications. This one is from Japan. Also, royal jelly, how and why it boosts our antioxidant levels. There are some literature about the antioxidant capacity of royal jelly as well. And there are some literature which is having comparison of bee products based on assays of antioxidant capacities of these products. You see another review, antioxidant potential of propolis, bee pollen, and royal jelly, which for us is important from a possible medical application point of view. In conclusion, we can say that integrative approach seeks to integrate the evidence-based conventional medicine with a broader understanding of nature of health incorporated by all healthcare systems, including traditional and complementary therapies as well. So from the preventive medicine point of view, we have to use the opportunity that we have, the potential of apitherapy as an integrative approach, integration of modern conventional medicine and traditional medicine because of the rich antioxidant capacity at least. So the apitherapy products with their antioxidant activity can be used in preventive medicine. And we can increase human health and we can decrease the risk of developing certain chronic illnesses if we can use apitherapy in preventive medicine. Well, thank you very much. And I hope that we can emphasize on preventive medicine and using apitherapy for prevention, not only for treating illnesses, we have to concentrate, we have to emphasize the preventive medicine with a holistic approach and integrative way. Thank you very much.
Your microphone, Professor Mustafa, activate, yeah. Yes.
I'm sorry about that. Thank you for this nice presentation. We all know about the importance of preventive medicine. However, our claims about the apitherapy products need to be based on hard medical evidence, like randomized controlled trials again. And this is the area where we should be concentrating on more. Let me tell you a few things about the chronic diseases. When we talk about the chronic diseases of this century, I think it's a little broad definition. We shouldn't be talking about chronic diseases of this century, but we should be talking about chronic diseases of the last 30, 40 years, starting from 1980s. Because from that era that we have seen explosion of cancer, diabetes, hypertension, heart disease, and all that chronic diseases that troubles us today. The question now is the big question. First, can we prevent them? I can tell you in a minute how. Yes, we can prevent them. The second, can we treat them effectively? When I say treat them, cure them or even reverse them. Can we reverse them effectively? Yes, we can reverse them effectively. And in the future prospects, is there a evidence-based, any evidence that we can put forward to discuss these claims? Yes, there are. what do I mean? I mean is we're going to have another Congress very soon in Kocaeli about this traditional medicine, and I'm going to present there how do we reverse and also effectively cure the chronic diseases of this age, modern age. But in here, if I outline very briefly, and maybe there'll be some research area in that sense. When Timuçin Hoca talk about preventive medicine, I understand primarily that to make the body in a protection mode, to put the body in a protection mode, to activate the protection mechanisms of the body and enable the body really to treat itself. How can we do that? There's a very nice, very nice experiment with this. They take some mouse and cancerous mouse. They put them into two groups, and in the groups, one fed normally, the other one fed nothing, 48 hours of hunger. And after that, they gave them really high concentration of chemotherapeutic agent. And this high chemotherapeutic agent, the group that fasted or that starved 48 hours previously in this group, all of them were intact. All of them survived because their internal mechanisms of protection is being activated. But the other group that being fed normally, all of them are actually were in a bad shape. Most of them are died. And when they look at the genetic markers afterwards, they see that epigenetic changes. So we can use hunger for preventive medicine, but because of apitherapy, today's topic, how can we utilize apitherapy in the refeeding period? For example, if someone is fasted for 3 days, 4 days, 2 days, 5 days, 7 days, whatever, and then can you restart feeding a little bit of with apitherapy products according to your aim? What do I mean by aim? For example, if our aim is preventing or treating diabetes, we should be choosing with the refeeding period anti-diabetic products. If our aim is, for example, potency or reproduction problems, maybe we can be starting refeeding period with apilarnil, for example, or etc. And this idea, I think, should be evaluated and be searched. And I hope many of you will be making some research program on this. And lastly, I am sorry we didn't have our Ukrainian guests today because their country is not very stable at the moment and they have lots of problems. I hope they'll overcome very soon and join us again. Before I close the session, anybody else would like to make some comment or some contribution, please do so.
Yes, Professor Unal, I'd like to make a few comments and then ask Dr. Zbuki also to say a few ideas. Excellent presentations from all of you. It's really fantastic event. Now, I hear many times this idea that we need more and more clinical studies. And it's true that we need to be very specific. But now I have one very interesting argument. I hope you will accept it. We know that beekeepers, they live longer than the rest of the population. There is a study done in Germany on 450 beekeepers. They took from the archives and they made a very nice statistical study. and they proved that beekeepers live in medium 3 years longer than the rest of the population. And we saw also here in our Congress, the presentation from Malaysia with Professor Kanan Tirumulu, which proved that beekeepers have longer telomeres than the rest of the population and better protection of the DNA. And now my point, I suggest you use this point in your future debates with your colleagues. If beekeepers live longer and better, is it not enough that we have over 7 million beekeepers in the world, which proves that apitherapy is healthy, prevents diseases, and they live longer and they are more stronger? You know, so this is, I think it's a good argument that beekeepers are really strong because of the bee products. And the Professor Kanan Tirumulu, he showed that beekeepers who took bee products daily more, they have had the telomeres even longer than their colleagues beekeepers. Okay, so what do you think about this idea, Professor Mustafa? With the 7 million beekeepers as our clinical studies.
Well, it doesn't matter whether 7 million or 27 million. It's important, the strength of the evidence.
Yes. Okay.
What you are describing here is the observational studies. And observational studies are not, their limited value in scientific circles. Because, for example, I have a gray hair. So I am getting old. That's an observational study. My gray hair associated my old health, and we can observe this. But can we cure it by dyeing our hair?
Yeah, okay, I
Therefore,
understand.
No, I understand what you're saying. It's very, very valid point. But for example, the telomere is a very positive argument. And also, somebody else might argue this. The beekeepers are healthy because they walk on the countryside more, because they spend more time in the nature. They are more in, have time for meditation, etc. When I say randomized control studies, that's a bit different. For example, if the previous experiment, why don't we take 2 groups of cancerous rats, for example, and give them 48 hours hunger and the other one, but refeed them. I'm sorry, because we have a limited time. That's why I couldn't explain very easily, very exploratory fashion. The problem is when they look at what happened, not only the side effect, but also the effects on the tumor. They saw that the tumors are being also affected badly. Tumors are not getting fat, they are more apoptotic, and they are actually, tumors are losing their strength. And they shown this in the DNA studies. Epigenetic studies and DNA studies are not very hard in this day and age. For example, one group will refeed with pollen. Next group will refeed with apillarnel. The other group with royal jelly. And look at their genetic expressions.
Yes.
And also look at their tumor cells. That is much more positive. One more thing, actually, we can, when we talk about the honey in this day and age, we'll be more, be careful. Because in the last, if you look at the disease causes of the last 30, 40 years, the main problem seems to be a flooding of sugar and insulin resistance. In this sugar river environment, the honey, for example, may not be adding much. It's entirely the age-related chronic diseases we're discussing. Now, the hunger actually opens up this period for us as well, that the insulin resistance is lowered and the glucose tolerance is lowered, and patient is ready like a white paper that we can write on it.
Yes, excellent comparison with the white paper. Very, very good. And just short comment about the pollen and the mice and the experiments. It was done a study in the United Kingdom, very interesting, on a special species of mice. And all these mice, they die earlier than the other mice. And all of them, they die of kidney amyloidosis, because they are genetically modified. So all of them dies earlier because of this genetical disorder. And this researcher from UK, he was curious. He gave to a group of mice only pollen. The diet was only pollen and water, nothing else. And the surprise was that these mice, they lived longer than the other mice, like in our comparison, like 120 years, not 80 years. And the big surprise is when he sacrificed the mice at the end, no more kidney amyloidosis. So he didn't find in the kidneys this amyloidosis, which is huge because it means that the polyphenols or enzymes, telomerase, whatever from pollen, change the genes of these mice and prolong the life. So there are such studies. You can find in royal jelly, in propolis, in bee venom too, and so on. And that thing that in Germany, they made like 450 beekeepers who lived longer than the rest of the population. This statistical study, 450 people, I think it's a big number. Okay, now one small comment about Dr. Zbukia, his presentation, a very nice presentation. And I'd like to add that Dr. Zbukia, I know him for a long time, for many years, and he has extensive experience, not only in this kind of case like he showed, he presented many other cases of burns and wounds treated with honey. One short point I would like to make here is if you looked carefully, he used polyfloral honey, like multifloral honey, not like Manuka honey or like Medi honey. So a very cheap honey, but very clean, very good, good quality and protected and so on, and verified, very checked, plus essential oil. And this is the $1 million idea, because Manuka honey is very expensive. I love the New Zealand people, I respect them, but the price of Manuka honey and all derived products is huge. It's like 2,000 euro per kilogram comes the final price. So you can have the same effect like Medi honey, Manuka honey, and so on. With a normal honey, you add essential oils, and you saw the good properties of essential oils, antibacterial, and so on. And the final product is even better than Manuka honey or Medi honey from the bacteriological point of view. So I encourage you to do this kind of studies. You take a very clean honey, you add essential oils, maybe like thyme oil or other oils. You can also extract of propolis, and we have other group in Romania who is using this mixture, honey plus propolis extract plus essential oil, and it's very powerful for the healing. So what do you think, Dr. Zbukia, about this idea to use this kind of method to use more honeys?
Yes, you are absolutely right. I think I have also used the combination of honey and propolis and the essential oils, especially for affected wounds and burns with multi-resistant germs, and I have a satisfactory results. But honey is a main ingredient and is very, very useful in the local treatment.
Professor, I'm sorry, this effect, is it actually coming from honey itself or the very concentrated sugar?
Yes, and this is a beneficial effect. It has an osmotic effect and also a nutritive effect. It brings a lot of nutritive elements in the wound.
Yes, there are over 6 mechanisms of action of honey in the wounds. And this one is like nourishing the healthy cells in the wound, which are still healthy. taking out the pus through osmotic pressure, like this one. But then you have the polyphenols, then you have many other, the acids from honey, which are antibacterial. So at least 6 such mechanisms. And Dr. Zbukia wrote a book on honey and the wounds. So we can invite him to give a lecture for 5 hours. Yes. Okay, Dr. Timochin, your presentation was also excellent. It's much better to prevent diseases than to cure them. And I remember from Chinese medicine, old style, like 2,000, 3,000 years ago, the people who were in the village working like normal farmers, but also treating people. And it's one other method, like in Japan, I know there is a big company, and the doctor from this big company is paid as long as the workers from the company are not ill. Now the medical system is vice versa. We pay the doctors when they have more diseased people. So
yes.
What do you think, Dr. Timochin?
Yes, exactly. Well, I hope we will make some changes in our approach, and prevention will be more important than treating the problem. If we can prevent, then we will not need so much to spend effort on treating, and it will be also cost effective.
Yes. Yes.
Thank you. Mustafa Hocam.
It has been very nice being with all of you, and we hope to have this meeting and this kind of meetings more in the future and in the very near future again. Thank you for all participants. See you in better days.
Thank you.